Hello everyone, I am Dr. Richa Bansal. I am a consultant gynecological surgeon, that is female cancer specialist surgeon and robotic surgeon at Apollo Hospital, Navi, Mumbai. Today I will be speaking about young women who are diagnosed with gynecological cancers and how are we dealing with this special group at our institute. Majority of the gynecological cancers that we see in our routine practice happen in older women, that is women who are nearing or have achieved their menopause. But a significant proportion of these gynec cancers can occur in younger women, and in fact we are seeing a rise in the incidence of gynec cancers in these young women. A major concern in treating young women with gynec cancers is the fact that whether we are able to preserve their fertility, that is ability to bear children in future. As you all can understand that the cancer is affecting the very particular organ that is required for the future childbearing. Treatment decisions in these young women have to be very strategically planned so as to be able to preserve their fertility whenever possible without compromising their cancer-related outcomes, that is, without compromising the cure rates from the cancer treatment. Fortunately, we are able to preserve fertility for many of these young women in our practice. For example, a young teenage girl who presents with a malignant ovarian mass can very well undergo surgical excision of this malignant ovarian mass with preservation of the opposite normal ovary and uterus and still allowing an optimal chance of cure from cancer for this young girl. This type of organ preserving approach is feasible only for a very select group of patients with cancer ovary, like for malignant germ cell tumors of the ovary and for some very low grade, slow growing tumors which generally have a good prognosis. Cancer of the cervix is another cancer that can occur in women and especially young women. And we do have many new treatment approaches to treat cervical cancer surgically, where we remove only the affected part and the surrounding tissues while preserving the uterus, bilateral ovaries and fallopian tubes with long-term cure rates while still being able to preserve their fertility potential. At this point, I would like to highlight that this specialized and advanced fertility treatment approaches are feasible for a very select group of patients who have been diagnosed with their cancer at a very early stage, be it cancer of the ovary, cancer of the cervix or cancer of the uterus. And we do have a very strict selection criteria to select these women because at any cost, we do not want to compromise their oncological outcomes. Similarly, when cancer of the uterus is diagnosed in a very young patient who is really very keen to preserve her childbearing potential, we are able to offer her hormonal treatment while being able to preserve her uterus and ovaries for her fertility. These women have to be counseled that this is not the standard treatment for their cancer and they have to remain under very close follow-up henceforth. So we oncosurgeons also work very closely with the infertility specialists when we are dealing with these young women with gynec cancers, because many of these young women are candidates for oocyte or embryo cryopreservation before initiating their cancer treatment, and these frozen eggs or embryos can be utilized in future for in vitro fertilization techniques or IVF techniques. Now, other aspect of treating these young women with gynec cancers is that many of these young women may be having hereditary or inherited cancer syndromes. These cancer syndromes can be passed on from the parent to the child, from the parent to the patient, and then she can pass on to the offsprings. So these young women have to undergo genetic counseling and genetic testing whenever appropriate. So thank you all, and do let us know if there are any queries and we will definitely sort them. Thank you very much.